If you're over 60, there's a stroke risk hiding in your morning routine, and it has nothing to do with your diet or your medications. It's something you do in the first 10 minutes after you wake up. Something so ordinary, so automatic, that you've probably never once thought to question it. Maybe you reach for your phone the second your eyes open. Maybe you swing your legs out of bed and stand up right away. Maybe your first move is a strong cup of coffee before you've even had a sip of water. None of that sounds dangerous. That's exactly the problem. Doctors have started paying closer attention to what happens in the body during those first waking minutes, because for people over 60, this is actually one of the riskiest windows of the entire day. Blood pressure shifts. Blood becomes slightly more concentrated. The heart has to work harder than at almost any other point in the next 24 hours. And certain everyday morning habits can make that window even riskier, quietly stacking the odds against you year after year without a single symptom to warn you. Here's the part that surprises most people. None of these habits feel harmful in the moment. They don't come with pain or dizziness or any obvious sign that something's wrong. That's exactly why they've been allowed to continue for years, sometimes decades, without anyone noticing the pattern. You're going to see yourself in at least one of these. Maybe more than one. But stay with me, because this isn't a video meant to scare you. It's meant to hand you a handful of small, simple shifts, the kind you can start tomorrow morning, that could help protect the years ahead. Let's start with a first habit, and it's probably not the one you'd expect. Let's start with something almost every one of you does without thinking twice: waking up and getting out of bed quickly. Maybe the alarm goes off, or maybe you just wake up on your own the way older adults often do, and within seconds, you're sitting up, swinging your legs over the side, and standing. Some of you are up and moving toward the bathroom or the kitchen within 30 seconds of opening your eyes. Here's what's happening inside your body during those 30 seconds, and why it matters so much more after 60 than it did at 40. While you sleep, your blood pressure naturally drops. Your heart rate slows down. Your whole circulatory system settles into a kind of nighttime rhythm: calm, low demand, unhurried. That's normal and healthy. It's supposed to happen. But the moment you sit up and stand, your body has to reverse all of that fast. Blood that was resting comfortably in your legs and lower body suddenly needs to rush back up to your brain and heart. In a younger body, blood vessels react quickly, they tighten up, blood pressure adjusts, and you barely notice the transition. After 60, that system doesn't respond nearly as fast. Blood vessels lose some of their elasticity. The nervous system reflex that's supposed to trigger an instant pressure adjustment gets a little slower, a little less reliable. So when you stand up quickly, your blood pressure can actually dip for a few seconds, right when your brain needs steady blood flow the most. That's the lightheaded feeling many of you already know. That flicker of dizziness when you stand up too fast. Most people brush it off as nothing. But doctors have a name for it: orthostatic hypotension, and it's more than just an annoying moment of wooziness. Here's where most people make a mistake. They assume that brief dizzy spell is harmless because it passes quickly. But that sudden pressure drop, repeated morning after morning, year after year, puts extra strain on blood vessels, and some research has linked frequent orthostatic hypotension to a higher long-term risk of cardiovascular problems, including stroke, in older adults. Think about your own mornings for a second. Do you wake up and get moving right away? Do you stand up fast because you need to use the bathroom, or because the dog is waiting, or because there's simply no reason to lie there? Most people do. It's not laziness or carelessness. It's just what feels natural. But there's a second part to this habit that makes it even riskier, and it's the part almost nobody talks about. It's not just standing up fast. It's standing up fast on an empty, dehydrated body. Overnight, you go 6, 7, 8 hours without a single sip of water. Your blood naturally concentrates slightly overnight as a result, since you keep losing fluid through breathing and normal metabolism while taking none in. So you're asking your circulatory system to make a rapid pressure adjustment at the exact moment your blood is most concentrated and your vessels are least prepared to respond quickly. That combination, rapid position change plus overnight fluid loss, is exactly the kind of everyday pattern that doesn't cause problems on any single morning, but quietly raises risk when it repeats for years. The good news is this particular habit is also one of the easiest to change, and we'll get to exactly how in just a bit. But first, there's a second morning habit, one involving what many of you reach for before anything else, that deserves just as much attention. Now, let's talk about the second habit, and this one might be the hardest to hear because for a lot of you, it's the very first thing you do each morning. That first cup of coffee. For millions of older adults, coffee isn't just a drink, it's a ritual. It's the smell that fills the kitchen, the warmth in your hands while you look out the window, the signal to your brain that the day has officially begun. And to be clear, this isn't a video telling you to give up your coffee. That's not where this is going. But here's what many people don't realize. The timing and the way you drink that first cup matters just as much as the coffee itself. Caffeine is a stimulant. That's exactly why it works. It wakes you up, sharpens your focus, gets you moving. But it does that partly by triggering a short-term release of stress hormones and temporarily tightening blood vessels, which raises blood pressure for a brief window after you drink it. In a younger, more flexible cardiovascular system, that's a small, brief blip. Nothing to worry about. After 60, especially in a body already managing blood pressure concerns, that spike can land differently. Remember what we just talked about, how your blood pressure is already unstable in those first waking minutes, already working to recover from its overnight low? Now add a stimulant that pushes it upward, often on a completely empty stomach, often before you've had any water at all. Here's the surprising part. Research looking at cardiovascular events has repeatedly pointed to the early morning hours, roughly between 6 and 10 a.m., as a time of day when strokes and heart attacks happen more often than you'd expect by chance. Doctors call this the morning surge, and it's a completely natural part of your body's rhythm. Blood pressure rises on its own in those hours, even without coffee. It's supposed to happen gradually. The concern is what happens when you stack a caffeine spike directly on top of that natural surge, first thing, before your body has had any chance to steady itself. This is where a lot of people make a mistake they don't even know they're making. They treat that first cup of coffee like a reward, drinking it quickly, on an empty stomach, sometimes before they've even brushed their teeth. It feels harmless. It feels like self-care even. But you may be adding an extra push on top of a system that's already naturally working harder during those exact hours. Let me paint a picture of how this can play out, the kind of routine many of you might recognize. Imagine a woman in her early 70s, healthy, active, who walks her dog every single day. Her routine for years was simple. Wake up, feed the dog, and pour herself a full mug of strong black coffee before she'd eaten or had any water. She wasn't doing anything unusual. Millions of people follow that exact pattern every single day. In a case like this, a doctor wouldn't necessarily say to quit coffee or say anything is wrong because nothing may be yet. What a doctor might point out is that a routine like this is stacking three things at once, right on top of each other, during the exact window when the body is already working hardest. Quick movement out of bed, caffeine on an empty, dehydrated stomach, and zero buffer time in between. That's the piece most people are missing. It's rarely one single habit that creates risk on its own. It's the stacking several small, seemingly harmless choices, all happening within the same 15-minute window, every single morning, for years. And there's one more overlooked detail that ties directly into this. Going a full night without fluids leaves your blood at its most concentrated point of the day on its own, separate from coffee, separate from moving quickly. Coffee has a mild, temporary diuretic effect in people who don't drink it regularly, which means it can nudge that overnight fluid loss slightly further for some people. It's not a dramatic effect, but paired with everything else, it's one more small factor working in the same direction. None of this means coffee is your enemy. It simply means the order and the timing of your morning matters far more than most people have ever been told. So now you might be wondering, if quick movement and early caffeine are both working against you, what does a genuinely stroke-smart morning actually look like? That's exactly what we're going to walk through next, because the changes involved are far simpler than you might think. So let's talk about what a stroke-smart morning actually looks like. And I promise you, none of this requires turning your life upside down. The first shift is simple. Before you do anything else, before your feet even hit the floor, take 60 seconds to just sit up in bed. Not stand. Sit. Let your legs hang off the side. Let your body register that it's transitioning out of sleep. And just breathe for a moment. This gives your blood vessels the time they need to catch up, to tighten, adjust, and stabilize your blood pressure before you ask your circulatory system to fight gravity. It sounds almost too simple to matter. But this one pause is one of the most consistently recommended habits among doctors who specialize in cardiovascular health in older adults, precisely because it directly targets that dangerous pressure dip we talked about earlier. The second shift is about water, and it might be the easiest change of all. Keep a glass of water on your nightstand every single night. Before you do anything else in the morning, before the phone, before the coffee, before your feet touch the ground, drink it. All of it if you can. Here's why this matters more than people expect. That overnight fluid loss we talked about? Rehydrating first thing helps your blood return to a more normal consistency, easing the load on your heart rate as it's trying to power through that natural morning surge. It's a 30-second habit that directly counters one of the exact mechanisms working against you. Now here's where most people get surprised. This next part isn't about giving up your coffee. It's about giving your body a head start first. Try waiting just 20 to 30 minutes after waking before that first cup. Let your body ease into its natural rhythm. Drink your water, sit up slowly, maybe stretch a little, maybe step outside for a minute of morning light. Then, when you do have your coffee, have a small bite of something with it, even just a few crackers or a piece of toast. Caffeine on a truly empty stomach tends to hit your system faster than caffeine alongside even a small amount of food. This is the kind of overlooked detail that rarely gets mentioned because it seems too minor to matter. But small buffers, a pause here, a glass of water there, a few bites of food, are exactly what take the stacked factors we talked about and space them apart so your body isn't managing several demands all at once. There's one more habit worth mentioning, and it surprises almost everyone who hears it: movement. Not exercise, just movement. A short, easy walk, even 5 or 10 minutes, sometime in that first hour after waking, and some research suggests this kind of light morning movement can help support healthy blood pressure through the rest of the morning more effectively than sitting still. You don't need to power walk around the block. Even walking to get the mail, or a few slow laps around the living room while your coffee brews, sends a signal to your cardiovascular system to start functioning smoothly rather than lurching from one demand to the next. Let's go back to that scenario we talked about earlier, the woman with the dog and the strong black coffee. If she had started making these changes, it might have looked something like this. She starts with just one, the glass of water by her bed. Then she adds the 60-second pause before standing. Within a few weeks, she notices something she hadn't expected. That lightheaded, woozy feeling she used to get almost every morning when she stood up has all but disappeared. She hadn't even realized how normal that dizziness had become until it was gone. That's often how this works. These changes don't feel dramatic in the moment, but your body notices, even when your mind doesn't point one last thing worth mentioning, and it's something many people overlook entirely. If you take blood pressure medication, mornings are actually one of the most important times to be consistent with it, and to take it at roughly the same time every day, exactly as your doctor prescribed. Skipping it, delaying it, or taking it inconsistently creates exactly the kind of unpredictable pressure swings we've been talking about this entire video. If you've ever wondered whether the exact timing of your medication really matters, this is why doctors emphasize it so consistently. None of these changes require special equipment, a big lifestyle overhaul, or giving up the things you enjoy. They simply require a little more intention in that first hour of your day, the hour that, as we've seen, matters more than almost any other. And now, let's bring all of this together, because there's one final piece of the puzzle that ties everything we've talked about into something you can actually put into practice starting tomorrow morning. So let's bring this all together, because by now you've probably recognized yourself in at least one of these habits, maybe more than one. And if you have, I want you to hear this clearly. Recognizing it is not a reason to feel afraid. It's the opposite. It's the exact thing that puts you back in control. Here's what we've walked through today. Your body moves through a naturally vulnerable window in those first waking hours, a time when blood pressure is already shifting, blood is already slightly more concentrated than usual, and your cardiovascular system is already working harder than it will at almost any other point in the day. That's not something you did wrong. That's simply how the human body works, especially after 60. What matters is what you stack on top of that natural window. Standing up too quickly. Reaching for caffeine before your body has had a chance to steady itself. Skipping water for 8, 9, sometimes 10 hours overnight. None of these are dramatic mistakes. They're quiet, ordinary habits, the kind almost everyone has, the kind nobody ever warned you about. And that's exactly why so few people ever think to change them. But now you know. And knowing is what makes tomorrow morning different from every morning that came before it. So here's your simple starting point, the same one we walked through together. Tonight, before you go to sleep, put a glass of water on your nightstand. Tomorrow morning, before your feet touch the floor, sit up first and give your body 60 seconds to catch up. Drink that water. Give yourself 20 or 30 quiet minutes before that first cup of coffee, and when you do have it, pair it with a small bite of something. And somewhere in that first hour, find a few minutes to simply move, a short walk, a few laps around the kitchen, anything that gets your body signaling to your heart that it's time to work smoothly, not urgently. None of this is complicated. None of it asks you to give up the routines you love. It simply asks you to give your body a little more time and a little more support during the hour when it needs it most. If today's video helped you see your own mornings a little differently, that's exactly what it was meant to do. Small, steady changes, the kind you can start tomorrow, are often what protect us most, not drastic overhauls we can't sustain. Take care of yourself this week. Be a little gentler with your mornings. And I'll see you again very soon, right here, with more of what your body needs you to know.